Did you know that doctors can instantly spot serious health issues just by noticing certain hygiene mistakes in their elderly patients? These seemingly innocent habits might be quietly signaling dangerous conditions developing in your body right now. The truly alarming part is that older adults have absolutely no idea they're making these critical mistakes every day. In the next few minutes, I'm going to reveal the 7 personal hygiene errors that doctors instantly recognize in their elderly patients, and how correcting them could literally save your life or the life of someone you care deeply about. The knowledge I'm about to share isn't taught in educational institutions, seldom discussed during medical appointments, and rarely mentioned in health publications. Yet, it could mean the difference between enjoying your retirement years in good health or suffering from avoidable conditions that steal your independence and dignity. Let me tell you about Frank, a 75-year-old retired engineer who believed his personal care routine was completely adequate. Frank was involved in his community, enjoyed golf twice weekly, and always attended his grandchildren's baseball games. During what he assumed was just a standard checkup, his physician immediately identified 3 critical hygiene mistakes that revealed Frank had been developing a serious condition for months without realizing it. "I had no clue," Frank later confessed to me. "I thought I was taking proper care of myself. If my doctor hadn't spotted these seemingly minor hygiene issues, I might not be here today to share my story." Today, I'll explain exactly what those mistakes were, so you can avoid Frank's frightening experience. But more importantly, I'll tell you precisely what to do instead. Simple adjustments that could add years to your life, beginning today. Mistake 1. Neglecting oral hygiene. When did you last really examine your toothbrush? Is it worn out and frayed? Are you brushing thoroughly twice daily? And here's the more crucial question. Did you know that poor dental care isn't just about bad breath or losing teeth? It's directly connected to heart disease, stroke, and even dementia. Geriatric specialists at Harvard Medical School have demonstrated that bacteria from untreated gum disease can enter your bloodstream and cause life-threatening cardiac conditions. In fact, their research indicates that seniors with poor oral hygiene are 3 times more likely to develop cardiovascular issues than those who maintain proper dental care. But don't just believe my words. Let me tell you about Martha, a 68-year-old retired school teacher from Oregon. Martha ignored her bleeding gums for months, assuming it was normal at her age. "I just figured that's what happens when you grow older," she said. But during a routine physical, her cardiologist discovered dangerous inflammation in her heart valves, directly caused by oral bacteria that had traveled through her bloodstream. The doctor informed her that had she waited just a few more months, the damage might have been irreversible. What should you do right now? First, inspect your toothbrush. If it's over 3 months old or showing any signs of wear, replace it immediately. Ideally, switch to an electric toothbrush, which removes 62% more plaque than manual brushing, according to studies at the University of Pennsylvania Dental School. Brush twice daily for a full 2 minutes. Each time, use a timer if necessary. Floss every single night, without exception. Never skip your dental checkups, even if you wear dentures. Have you noticed any bleeding when brushing? Any swelling in your gums? These aren't normal aging signs. They're warning signals your body is sending you. Don't ignore them for another day. Mistake 2. Infrequent bathing and skin care. How often are you bathing? Be honest with yourself. Many seniors reduce their bathing frequency as they age. But did you know your skin is your largest organ, and changes in its condition can reveal serious internal problems before other symptoms appear? Dermatologists from the Mayo Clinic warn that reduced bathing frequency in seniors often masks early signs of diabetes, liver problems, and cardiac issues. Their clinical studies reveal that nearly 40% of undiagnosed medical conditions in elderly patients could have been caught earlier through proper skin observation. Consider what happened to Thomas, a 77-year-old retired postal worker from Michigan. Thomas thought bathing once weekly was sufficient, especially during winter months when his skin felt dry. "I didn't want to dry out my skin," he explained, but when his physician noted unusual skin discoloration during an appointment for an unrelated matter, further testing revealed early-stage kidney disease. The discoloration wasn't due to poor hygiene itself. Rather, the infrequent bathing had hidden a critical symptom that could have been spotted weeks earlier. Establish a regular bathing schedule, at least 3 times weekly, even if you're not particularly active. Use mild, fragrance-free soap that won't strip your skin's natural oils. After bathing, apply moisturizer while your skin is still slightly damp to lock in hydration. Most importantly, regularly examine your skin for unusual changes in color, texture, or sensation. Are you noticing dry, flaky patches, unusual discoloration, areas that itch persistently? These could be your body's way of alerting you to something much more serious happening internally. Don't wait another day to address these warning signs. Mistake 3. Ignoring nail care. Take a moment right now to look at your fingernails and toenails. What do you see? Are they neatly trimmed, clean underneath, free from discoloration? The condition of your nails is a window to your overall health, and one that doctors check immediately when evaluating elderly patients. According to the American Academy of Dermatology, nail changes can indicate over 20 different systemic diseases, from anemia to thyroid issues to heart disease. Their research shows that in patients over 65, nail abnormalities led to the diagnosis of previously undetected internal conditions in nearly 30% of cases. Let me share Jennifer's story. At 82, Jennifer didn't think her thickening, yellowing toenails were concerning. She simply stopped wearing sandals and hid them in closed shoes. "I figured it was just part of getting older," she told me. But when she finally saw a podiatrist for foot pain, the doctor immediately diagnosed a fungal infection that had been allowed to flourish for so long it revealed her severely suppressed immune system. Further testing uncovered a serious underlying condition that required immediate treatment. Trim your nails regularly, straight across with slightly rounded edges, to prevent ingrown nails. Keep them clean and dry. Wear breathable footwear and change your socks daily. Never ignore changes in nail color, texture, or thickness. These aren't cosmetic issues. They're potential warning signals from your body. Are your nails brittle, discolored, or thickened? These changes aren't inevitable parts of aging. They're your body trying to tell you something important. Will you listen before it's too late? Mistake 4. Improper incontinence management. This is perhaps the most shocking hygiene mistake because of how common it is and how desperately people try to hide it. Over 50% of seniors are silently dealing with some form of incontinence, but the truly alarming part is how many hide it instead of seeking proper treatment. Urologists from Johns Hopkins Medicine report that untreated incontinence leads to dangerous skin infections, falls, social isolation, and can even mask serious conditions like bladder or prostate cancer. Their studies reveal that seniors who properly manage incontinence issues experience 60% fewer complications than those who attempt to hide the problem. Take Michael, a 73-year-old retired accountant from Arizona. Michael was too embarrassed to mention his occasional leakage to his doctor. He used paper towels and changed his clothes frequently, thinking he was managing the problem. When he finally sought help, after developing painful sores, doctors discovered an advanced prostate condition that could have been treated months earlier with much better outcomes. "My pride nearly cost me my life," Michael admitted. "I wish I had talked to my doctor at the first sign of a problem instead of trying to hide it." What should you do if you're experiencing any form of incontinence? First, never be embarrassed to discuss bladder issues with your doctor. They see this every single day. Use proper absorbent products designed specifically for incontinence rather than makeshift solutions. Change promptly when wet and follow a proper cleansing routine to prevent skin breakdown. Most importantly, recognize that incontinence is not a normal part of aging. It's often a symptom that something needs medical attention. Are you experiencing occasional leakage, finding yourself planning outings around bathroom availability, using makeshift protection? Don't wait another day to speak with your doctor. Your health, and possibly your life, may depend on it. Mistake 5. Ear hygiene errors. What's your ear cleaning routine? Be honest with yourself. Are you using cotton swabs, inserting them deep into your ear canal? If so, you're making a dangerous mistake, one that many seniors make every day. Many older adults are damaging their hearing and missing signs of serious infection due to improper ear cleaning. Otolaryngologists warn that improper ear hygiene is responsible for nearly 40% of ear canal injuries in patients over 65, many of which lead to infections that could have been completely avoided. Let me tell you about Elizabeth, a 71-year-old retired librarian from Washington. Elizabeth regularly used cotton swabs to clean deep inside her ears until she punctured her eardrum, leading to a severe infection that spread to nearby tissue. "I had always cleaned my ears this way," she explained. "No one ever told me it was dangerous." Elizabeth required emergency treatment and suffered permanent hearing damage that could have been entirely prevented. What's the correct approach to ear hygiene? Remember this simple rule. Never insert anything smaller than your elbow into your ear canal. Clean only the outer ear with a warm, damp washcloth. If you feel you have excess wax, use ear drops specifically designed to soften wax and follow the package directions precisely. See a doctor immediately if you experience pain, discharge, or hearing changes. Are your ears itchy, feeling full, or blocked? Experiencing unexplained hearing changes? Don't attempt to resolve these problems yourself. They require professional medical attention. Your hearing is precious. Protect it with proper care. Mistake 6. Poor foot hygiene. When was the last time you really looked at your feet? Not just a passing glance, but a thorough inspection of every part, between the toes, the heels, the soles. Your feet contain vital clues about your circulatory and nervous systems, clues that doctors check first in elderly patients. Podiatrists specializing in geriatric care at the American Podiatric Medical Association state that foot hygiene issues often reveal the first signs of diabetes, neuropathy, and vascular disease. Their studies show that in patients over 65, proper foot care and regular inspection could prevent up to 85% of diabetes-related amputations. That's not a typo. 85% of amputations could be prevented with proper foot care. Consider Richard, a 76-year-old retired factory worker from Illinois. Richard ignored the dryness and minor cuts on his feet, assuming they were just normal signs of aging. "My feet had been looking rough for years," he admitted. But when his doctor noticed them during a routine exam, he immediately ordered diabetes testing, catching the disease in its early stages when lifestyle changes could still make a significant difference. "If my doctor hadn't checked my feet, I might have gone years without knowing I had diabetes," Richard told me. "By then, the damage would have been severe." What should you do starting today? Wash and thoroughly dry your feet daily, especially between the toes, where fungus loves to grow. Inspect them regularly for cuts, sores, or changes in color or temperature. Wear clean, dry socks made of natural fibers or moisture-wicking materials. Apply moisturizer to dry areas, but not between the toes. Never ignore pain, numbness, or wounds that don't heal. See a medical professional immediately. Are your feet dry and cracked? Notice any cuts that aren't healing properly? Any unusual discoloration or loss of feeling? These aren't just cosmetic issues. They could be early warning signs of serious conditions that need immediate attention. Mistake 7. Medication-related hygiene issues. Are you taking multiple medications? Have you noticed changes in your body odor, sweating patterns, or mouth dryness since starting them? The medications keeping you alive might be causing hygiene problems that signal dangerous side effects. Pharmacologists at the American Geriatric Society have documented how certain commonly prescribed medications cause dry mouth, excessive sweating, or body odor changes, indications of potential toxicity. Their research shows that nearly 40% of adverse drug reactions in seniors present first as changes in personal hygiene needs before more serious symptoms appear. Take Susan, a 67-year-old retired nurse from Florida. Susan's unusual body odor was dismissed by her family as poor hygiene until her geriatrician recognized it as a sign of medication toxicity that was slowly damaging her liver. "I was showering regularly and using deodorant," Susan explained. "I had no idea the smell was coming from inside my body, not from lack of cleanliness." What can you do to protect yourself? Track all hygiene changes after starting new medications. Keep a simple journal noting any differences in body odor, sweating, mouth dryness, or skin changes. Stay properly hydrated unless otherwise instructed by your doctor. Report unusual sweating or odor changes to your doctor immediately, as these could indicate dangerous drug interactions. Never adjust dosages without medical supervision. Even if you think the medication is causing hygiene issues, have you noticed unusual body odor despite regular bathing? Excessive sweating? Extreme mouth dryness? Don't attribute these changes to normal aging. They could be warning you of potentially life-threatening medication effects that need immediate attention. Now you know the 7 critical hygiene mistakes that doctors immediately notice in their elderly patients, and exactly how to correct them. By addressing these issues today, you can prevent serious health problems, maintain your dignity and independence, and potentially add years to your life. Remember, proper hygiene isn't just about appearance or social courtesy. It's a vital part of maintaining your health as you age. These simple changes could literally save your life. If you found this information valuable, please hit the like button right now. Has your doctor ever noticed any of these hygiene issues during your visits? Share your experience in the comments below. Don't forget to subscribe and hit the notification bell to receive more potentially life-saving content like this. Please share this video with your loved ones who are over 65. This knowledge could literally save their lives.